Chapter 13, Young and Middle Adults. Both young and middle adulthood are developmental periods that may pose challenges, rewards, and crises. Challenges will include the demands of working, raising families, and other crises like caring for aging parents or possibility of job loss in an ever-changing economic environment. Young adults are faced with tasks of identity development, who they want to be, and how they want to attain their goals. These individuals adapt well to new experiences and are more ethnically and racially diverse than other generations. Young adults increasingly move away from their families of origin, establish career goals, and decide whether to marry or remain single and whether or not to begin a family. Young adults are usually quite active, experience severe illnesses less frequently than older age groups, tend to ignore physical symptoms, and often postpone seeking health care. Their physical strength typically peaks, and characteristics of young adults begin to change physically as middle age approaches. Physical changes in weight and muscle loss will occur as a result of diet, exercise, and lifestyle patterns. Critical thinking habits will increase steadily throughout young adult years. Identifying an occupational direction is a major task of a young adulthood. Adults enter the teaching-learning situation with the background of unique life experiences, including illness and injuries. Young adults are constantly evolving and adjusting to changes in the home, workplace, and social environment. Their decision-making processes need to be flexible. For young adults, parent-child nurturing is important in adapting to a newborn. Emotional health of the young adult is related to the ability to address and resolve personal and social tasks. Young adult is often caught between wanting to prolong some freedom of their adolescence, but yet assume adult commitments. Between ages of 29 to 34, the young adult directs enormous energy toward achievement and mastery of the surrounding world. Between the ages of 35 to 40 are a time of vigorous examination of their goals and their relationships. Health is not merely the absence of disease, it also involves wellness throughout all human dimensions. A family history of cardiovascular, renal, endocrine, or neoplastic disease will increase the young adult's risk of illness. Successful employment is important in the lives of most individuals. This not only helps to ensure economic security, but also leads to fulfillment, friendships, social activities, support, and respect from coworkers. The young adult usually has emotional maturity to complement the physical ability and is able to develop mature sexual relationships and ensure intimacy. Young adults who have failed to achieve the developmental task of personal integration may develop relationships that are superficial and stereotype. Conception, pregnancy, birth are major phases of the childbearing cycle. The changes that occur during these phases are complex. Childbirth education practice classes may prepare pregnant women and their partners to participate in the birthing process. The social pressures to get married has changed, and some young adults may choose not to marry until their late 20s or early 30s. For young adults who remain single, parents and siblings may become the nucleus for the family. Some will view their close friends and associates as family. Economic considerations frequently enter into decision-making processes because of the expense of child rearing. Young adults need physical and emotional resources and support systems to meet the many challenges, tasks, and responsibilities that they face. When reading this case study, think about how Crystal's grandchildren affect Crystal's psychosocial development and how a nurse can improve the overall health of the family. What does Lewis know about the household from his observations of the family. He figures out that Crystal is a mother of two, has a daughter, Monica, and a son, Zachary, and is in her third semester with her child. What has Lewis learned about the development of Monica's children? Family history of a disease sometimes puts a young adult at risk for developing it in the middle or older adult years. Sharing utensils with a person who has a contagious disease increases the risk of illness. Poor dental hygiene increases the risk of periodontal disease. Violence is an all too common cause of mortality and morbidity in young adult populations. Factors that predispose individuals to violence, injury, or death may include poverty, family breakdown, child abuse and neglect, opioid and other drug use, repeated exposure to violence, and readily access to guns. Intimate partner violence, commonly known as domestic violence, is now a global public health situation. This exists along a continuum from a single episode of violence to ongoing battery and violence. It often begins with emotional or mental abuse and can progress to physical or sexual assault. Substance abuse is a social problem that directly or indirectly contributes to mortality and morbidity in young adults. Substance abuse can include alcohol and drugs. Social problem is the number of youth and young adults who run away or are homeless. Many risk becoming involved in illegal or dangerous activities to survive, which will include human trafficking. Unplanned pregnancies can create stress that may result in adverse health outcomes for the mother, infant, and family. Often, young adults have educational or career goals that take precedence over family development. Interference with these goals often affects future relationships as well as parent-child relationships. Sexually transmitted infections, syphilis, chlamydia, gonorrhea, genital herpes, human papillovirus, and acquired immunodeficiency syndrome are a major health problem in young adults. These infections have immediate and physical effects such as genital discharge, discomfort, and infection, and they can also lead to chronic disorders, cancer, infertility, or even death. Common environmental or occupational risk factor is exposure to work-related hazards or agents that may cause diseases and cancer. What nursing diagnoses do you believe to be appropriate for Crystal and her family? How can Lewis help Crystal and the family prepare for the new baby? Some lifestyle choices will put young adults at risk for illness or disabilities during their middle or older adult years. Young adults are genetically susceptible to certain chronic diseases like diabetes mellitus and familial hypercholesterolemia. The psychosocial health concerns of the young adult are often related to job and family stressors. Stress is valuable because it can motivate a patient to change. Job stress can occur every day or from time to time. Most young adults are able to handle day-to-day crises. Because of the multiplicity of changing relationships and structures in the emerging young adult family, stress is frequently high. Situational family stressors occur during life events, births, deaths, illnesses, job losses. Infertility is the result of a disease of either the male or the female reproductive tract that prevents the conception of a child or the ability to carry a pregnancy to delivery. Infertility evaluation will begin after a couple has unprotected intercourse for about 12 months with the failure to conceive. Obesity is a major health problem. and it is influenced by poor diet, include eating fast food, excessive sugar intake, and increases in proportion size, as well as a decline in physical activity. Individuals of all ages benefit from regular physical activity. Young adults spend more time with technology and less time engaged in physical activity. Exercise in the young adult is important to prevent or decrease obesity, as well as the development of chronic health conditions like high blood pressure, diabetes, and some cancers. The developmental task for many of the young adult couples is the decision to begin a family. Although physiological changes of pregnancy and childbirth occur only in women, cognitive and psychosocial changes and health concerns will affect the entire childbearing family, including the baby's father, siblings, and often the grandparents. The ability to handle day-to-day challenges at work minimizes stress. Prenatal care is the routine examination of the pregnant woman by a provider. Prenatal care includes a thorough physical assessment of the pregnant woman during regularly scheduled intervals, provision of information regarding sexually transmitted infections, other vaginal infections, and urinary infections that will adversely affect the fetus, and counseling about exercise patterns, diet, and childcare. All women experience some physiological changes in their first trimester: morning sickness, breast enlargement and tenderness, as well as fatigue. During the second trimester, growth of the uterus and fetus results in some physical changes of pregnancy. In the third trimester, there's an increase in Braxton Hicks contractions, which are irregular short contractions, as well as fatigue and urinary frequency. Postpartum is a period of approximately 6 weeks after delivery. During this time, the woman's body reverts to its pre-pregnant physical status. The entire childbearing family needs education about pregnancy, labor, delivery, breastfeeding, and integration of the newborn into the family structure. While reading this case study, what knowledge and health outcomes might be appropriate for Crystal and her family? Think about before her next checkup that Crystal should learn about the dangers of smoking for herself, her unborn baby, and her other children. Crystal should keep lighters and matches out of the children's reach, and she should begin to prepare the other children for the birth of their sibling. She should continue to keep her children's health checkups, and her children should receive appropriate immunizations during their next clinical visit. Acute minor illnesses cause a disruption in life activities of young adults and may increase stress in an already hectic lifestyle. The lack of insurance or underinsurance, dependency, and limitations posed by treatment regimes may also increase frustration. The young adult's need for restorative and continuing care often results from motor vehicle accidents, trauma from violence, or chronic diseases affecting the young adult population, like multiple sclerosis, rheumatoid arthritis, AIDS, or cancer. Which of the following might be a cause of stress for young adults? Being single, career, sexuality, activity. The answer is A, B, and C. Depending on the situation of the adult, being pressured about their single status, career choices, and sexuality are all stressors that can impair the health of the young adult. What is the next step in the continuing of care for Crystal? Think about the books that Crystal found on childbirth that helped her children understand the upcoming birth of their sibling. Crystal's question about managing her children will provide an opportunity to continue the care through the education for her family. Middle adults enjoy helping young people become productive and responsible adults. Middle adults often find joy in helping their children and other young individuals become productive and responsible, and also begin to help aging parents while being responsible for their own children. This puts them in the sandwich generation. High self-esteem, which is a favorable body image, and a positive attitude toward physiological changes occur when middle adults engage in physical exercise, eat balanced meals, and obtain adequate sleep while following good hygiene practice that can promote vigorous and healthy bodies. Major physiological changes occur between 40 to 65 years of age. Most visible changes during middle adulthood are graying of the hair, wrinkling of the skin, and thickening of the waist. Decreases in hearing and visual acuity are often evident during this period. Menopause is a disruption of the menstrual cycle, primarily because of the inability of the neurohormonal system to maintain its periodic stimulation of the endocrine system. The ovaries no longer produce estrogen and progesterone, and the blood levels of these hormones will drop rapidly. Psychosocial changes in middle adult involve unexpected events like children moving away, or separation from the partner, or death of a partner or a close friend. The middle adult years, children will depart from the household. The family will enter the post-parental family stage. Time and financial demands of the parents typically will decrease, and the couple faces task of redefining their own relationship. During this period, many middle-aged adults take on healthier lifestyles. Career changes can occur by choice or due to a result of changes in the workplace or society. Many couples will redefine their relationships and find increased marital and sexual satisfaction. Many adults over the age of 35 have never been married in the United States. Many are college-educated individuals who embrace the philosophy of choice and freedom, delayed marriage, and delayed parenthood. Some middle adults choose to remain single but also opt to become parents either biologically or through adoption. Middle marital changes occurring during middle age may include death of a spouse, separation, divorce, or the choice of remarrying or remaining single. A widowed, separated, or divorced patient goes through a period of grief and loss that is necessary to adapt to the change in the marital status. The departure of the last child from the home can also be a stressor. Many parents welcome freedom, but some parents feel lonely and without direction. Many middle adults will find themselves caught between the responsibilities of caring for their dependent children and those of caring for their aging and ailing parents. Middle adults experience physiological changes and face some health realities. Their perceptions of health and health behaviors are often important factors in maintaining their health. It is important to remember that all adults should maintain regular fitness as they grow older. Routine exercise, 20 to 30 minutes, 5 to 6 times a week, will promote health. Stress across the lifespan is a health concern. In the complex world, individuals are more prone to stress-related illnesses such as heart attacks and hypertension. Obesity is a growing and expensive health concern. It is a complicated, multifactorial disease with genetic, behavioral, socioeconomic, and environmental origins. Obesity reduces the quality of life and increases the risk for many serious chronic diseases as well as premature death. Positive health habits help maintain optimal function and reduce risk of chronic illnesses. Health literacy may be defined as the cognitive and social skills that will determine the motivation and ability of individuals to gain access to, understand, and use information in ways that promote maintaining good health. Health literacy is essential for an individual to take responsibility for their own health. Anxiety is a critical maturational phenomenon related to change, conflict, and perceived control of the environment. Adults often experience anxiety in response to physiological and psychosocial changes of the middle-aged years. Depression is a mood disorder that manifests itself in multiple ways. Early onset dementia or presenile dementia defines all dementia-related conditions before the age of 65. Depression and anxiety are prominent. As early onset dementia progresses, agitation, apathy, and irritability will worsen. Acute illnesses and conditions experienced in middle adulthood are similar to those of young adulthood. Injuries and acute illnesses require a longer recovery period in middle adulthood because of the slowing of the healing process. Which of the following might be a cause of stress for the middle-aged adult? Financial security, planned retirement, arrival of grandchildren, caring for children and aging parents. The answer is D. Known as the sandwich generation, middle-aged adults are caring for both their children and their aging parents. This may cause additional stressors in their lives.